All right. Well, good afternoon, everyone. I appreciate everyone taking the time to be here with us. My name is Lee Harrell. I am the Vice President of Advocacy with the Tennesseans for Quality Early Education organization. I appreciate you being here today. If you haven't submitted questions, we look forward to hearing from you throughout the webinar. I want to say a special thank you to several legislators who have registered and who are attending on the webinar, in addition to our panelists. But thank you for taking the time to listen into this webinar about this important legislation. A few housekeeping items. This is a webinar format structure, so your video and the chat box have been disabled. You may submit questions in the Q&A box that is below the screen of your Zoom screen there. And we've had some questions already submitted. We'll take those questions at the end of the presentations, and we'll also take whatever questions you have submitted throughout. We'll get to as many of those as we can. And if you're willing, you may be prompted to unmute yourself and actually ask that question of our legislative panelists directly to them. Again, if we don't get to your question, we apologize. We'll try to answer it either directly in the Q&A box or after this session. A reminder that this webinar is being recorded and will be made available at a future date. And just a quick run through of today's agenda. We'll have a conversation with our legislators around the Tennessee Opportunity Act, and then we'll take some Q&A, and then we at TQEE will briefly discuss two other legislative priorities, one around the Child Care Task Force and one around the funding for school nurses. But I want to jump in very quickly to our legislative panelists, Representative David Hawk of Greenville and Senator Bo Watson of Hickson in Hamilton County. Gentlemen, thank you so much for being here. Would love it if you would just kick us off discussing the work over the past year and a half that you all have done with other legislators on the TANF working group as appointed by the Lieutenant Governor and Speaker of the House, and then just what you see as the overarching issues and importance of the TANF program going forward.
Well, of course, Lee, thank you very much. And thank you for TQEE for sponsoring this, I guess, and getting it together at least. I know Representative Hawk and I are very appreciative of the opportunity to talk about what we think it's a pretty good piece of legislation that's been developed over the past year. But before doing that, I think if I can kind of let your audience know how we got here, and then I'll yield to Representative Hawk, and I think Ms. Taylor has some comments as well. So about this time last year, you may remember it was reported that the TANF program in the state of Tennessee had this surplus, or actually capacity of, well up in the $750 million. And the two leaders of the two chambers decided to put together a working group to sort of decide how we make decisions about spending that money, why we had accumulated the capacity that we had accumulated, what the actual amount was. So there was a lot of discussion, a lot of ideas about how we might utilize the resources. Some of the folks in the audience may remember the $50 million in grants for two-generation grant programs came out of that task force. And so the task force was really just starting to germinate and generate ideas when, of course, the pandemic hit and everything kind of got off base and off track. But Representative Hawk and I, along with groups like TQEE, continued to work on the project, and I'm sure other members have as well. I'm sure that the department has as well. And what we will discuss with you today is our approach that we would present to the members of the General Assembly and to the administration of a strategy of how we might efficiently and effectively utilize those TANF dollars. So that's how we got to today. I'll yield to my good friend, Representative Hawk.
Thank you, Senator Watson. And again, thank you to TQEE for organizing this event, all the work that's gone into it, the work of our legislative colleagues, as Senator Watson mentioned, that have been on this working group. A little over a year ago, we went into the study and survey of exactly how we got the surplus or the capacity to spend $750 million, how we arrived there, and all the good and bad that go along with that. Now we're looking at how we can best disseminate that. And I keep a little note card by my desk as we're talking about this particular legislation, and ultimately 2 words: strengthen families. That's what we're looking to do. When you strengthen families, you strengthen communities, which strengthens our state. So we want to see how we can best utilize this capacity of dollars to go within the 4 tenets, the 4 tenets that TANF abides by, and ultimately making our families stronger. So that's what we want to do. We've got certain plans and certain thoughts to put money toward this, that, and the other. We're going to be looking at creating an advisory committee that's going to closely study these grant applications and give us an idea where we're going to get the best bang for our buck, and go forward from there. Blair, I'll let you jump in there and lead us off to discussion of the bill itself.
Sure. Well, we just can't thank you guys enough, Senator Watson and Representative Hawk, for your leadership. This is everybody. I think most of us out here in the land of Tennessee were sort of shocked when the news came out about the surplus, and I just can't say enough about how the 2 of you and the TANF working group have just really spent time to dig in, to study, to learn, to understand, and to now for the 2 of you to have stepped up with some really thoughtful and bold leadership on this matter, and it's just greatly appreciated. So I'm gonna do a couple things. I'm going to give a little bit of context, and then I'm going to hit some of the high notes, really kind of the 3 major chunks of the bill. I'm going to take about 6 minutes to go through this, and then we're going to flip it back to Senator Watson and Representative Hawk to kind of fill in whatever they would like, and then we'll open it up to questions after that. So let me jump right in here. I mean, you all, I think, know, and Senator Watson, you may have just mentioned this, Tennessee's federal annual block grant for TANF, the Temporary Assistance for Needy Families Program, is $191 million. And in recent years, we've been spending as a state less than half that. And that's why we've gotten ourselves to this surplus that we have, which is actually the largest in the nation, TANF surplus. The sort of context that I think is important is, let me just hit a couple of high points. I think probably most of us understand the poverty in our state and in our local communities, but half of all children age 0 to 8, that's more than 350,000 children in Tennessee live in households with incomes below 200% of the poverty level. And that's 52,000 annually for a family of 2 adults and 2 children. And compare that 52 with what the United Ways of Tennessee's ALICE study tells us, which is that a survival budget is 65,000 for that same family. And the ALICE study also said that 47% of all Tennessee households reported, this was last year, reported being one emergency away from financial ruin. All of that data was pre-COVID, and so we know that that's only worsened as a result of the pandemic. And since we are Tennesseans for Quality Early Education, I just want to note what's well known, which is that there's a strong correlation between economic disadvantage and lower education achievement. And we know also that there's well-documented evidence that investments in high quality early education can have a strong return on investment. And we also know, and Senator Watson mentioned 2-gen approaches, and this bill really embraces that 2-gen approaches that provide supports for both children and their parents at the same time can really be very cost effective if implemented well. And so how can these funds be used? We had a couple of questions about that, and I am not a TANF expert, but what we know, and in fact, what the comptroller told us in some of his reports to the working group, the TANF working group, is that he confirmed the funds are very flexible, can be used for a broad range of services that can help families overcome hardship. So there's a basic cash assistance program that we all, I think, are familiar with, where eligible families get cash payments for the basics. These funds can go to childcare, they can go to evidence-based home visiting programs, they can go to mental health counseling, substance abuse services, after school and tutoring, job training, apprenticeship programs, emergency help for families in crisis like food and housing. So a broad array of uses. And so now let me just kind of, with that sort of frame, let's talk a little bit about the bill. It does three main things. First, it establishes a reasonable reserve at 191 million. I'm going to talk about that in just a minute, throw up a chart here. Then it provides 300 million of the current reserve. It obligates it over 3.5 years for this Tennessee Opportunity Pilot Initiative, which we'll talk a little bit more about. And then thirdly, it stipulates that going forward, the TANF funds must be, A, really must be used, and B, that they get to where the need is. And so I'm just briefly going to talk about all three of these. And Jonathan, if you would put up the chart, the graph with the statewide comparisons. This is, if y'all can take a look at this, what this shows and what this is a chart of, those are all the 50 states lined up there at the bottom. And these are their, the bars represent their reserve amount, their surplus amount as a share of annual federal TANF block grant. Each state gets a different amount, but this is the percentage that they maintain and are maintaining as their reserve. You can see Tennessee is at 383%. We're the far left. So 732 million is 383% of our federal annual block grant of 191 million. 40 of those states are below 100%. That red line going horizontal is 100%. So 40 states fall below that. What's proposed in this bill is that the reserve be set at 191 million. And that would put us then, it would move us to sort of 10th position compared to 40th in the nation, highest reserve. And you know, just speaking a little bit about reserve and how do you come up with a reserve, and our comptroller told us that there really is no best practice. There's not kind of rules or regulations about how states figure out what kind of reserve they should maintain. Our state government leans fiscally conservative, and I think this 191 million reflects that. It, as I mentioned, it moves Tennessee from #1 largest to still a pretty conservative 10th largest in the nation. It covers a year's worth of TANF operations, even though we've actually got a track record of just only spending less than half our annual allotment. And then you compare it and you think about other Tennessee types of reserve funds. This is very different. This is not a reserve fund sitting on our books that we can invest or give back to taxpayers. This actually sits at the federal government. It's really capacity, as Senator Bo Watson has referred to it. It's our capacity to draw down funds. But if you think about our other two big reserve funds as a state, we have a rainy day fund and we have a TennCare fund. The Sycamore Institute tells us that those two together combined would cover about 33 days worth of state funded general fund operations. So covering a full 365 days worth of TANF operations is comparatively quite conservative. Second piece, kind of big chunk of the bill, and this is, I think, just really, really cool, very excited about this, the Tennessee Opportunity Pilot. And this pilot would set aside 300 million, as I mentioned, over a 3.5-year period for communities to design and implement strategic plans to mitigate the effects of child poverty and to promote family economic self-sufficiency and well-being. And these would be locally driven plans. They would require 2-gen approaches, and they would use evidence-based or evidence-informed solutions. There's a planning grant round, so any community can apply for, would be able to apply for a planning grant. Then there's an implementation grant round. So presumably communities who had submitted and applied for a planning grant would then have their plans and would submit those plans as part of a competitive process for an award, an implementation grant award. And this bill says that 8 communities would be awarded ultimately those implementation grants. And the communities would, it's kind of stipulates that the communities have to represent a mix of rural, urban, and suburban communities. Communities can be cities, they can be counties, they can be multi-county regions. And very, very importantly, the bill requires that all the communities who are awarded those implementation grants actually get to participate, or they must participate in a research and evaluation component of the work. That's a really important part of this, a kind of a research practice partnership, if you will. And it's not the kind of evaluation that's sort of the end of 3 years of implementation. We just find out, oh, this worked or it didn't work. It's meant to be an active research partnership where there's learning along the way, there's guidance, there's data feedback, so that we can course correct, so that communities are able to course correct, say this is working, it's not working, how can we adjust, tweak, so that we're really making sure these funds are going to good use. And at the end, we have some really great data and great proof points for how TANF funds can be used more effectively in the future. So the bill calls for an advocacy, an advisory panel that's appointed by the Speaker and Lieutenant Governor, and that advisory panel works with DHS and the research partners and the participating communities over the full course of the implementation. And ultimately, they would deliver a report back to the General Assembly and the administration about their learning and recommendations for use of TANF funds going forward. And the last thing is that, the last piece of that is that it suggests that the bill stipulates that there be engaged some TANF expertise to advise communities on best practices, allowed uses of TANF. We know there are a lot of questions out there about that, and it's while the bill allows for, and the federal law allows for a lot of flexibility, compliance is very important, and so that would be critical. And then very last, and I'll take another 30 seconds on this, but the third major component addresses the rest of the reserve and the ongoing annual block grant and how that is to be spent. And it basically says that once you've set aside the reserve, once you've set aside your admin cost for running the program, and once you've set aside the cash assistance program, and you've obligated also this $300 million for the pilot project, the rest of everything, of which there is still a lot, would continue to be overseen by DHS, but it would be required that it be used in counties proportionally to their share of children in poverty, and really thus kind of ensuring that the funds get to where the need is. So this is a pretty robust and bold new approach to getting the funds where the need is. And I'm going to just stop there, and I'm going to turn it back over to Senator Watson or Representative Hawk to make whatever comments they'd like to make before we get into questions.
All right. Well, that was pretty thorough, Blair. Thank you. So for your audience, just to sort of recap, at least in Representative Hawk and I's mind, there are components that are critical to understand. You know, in the legislature, if you want to know what a bill does, you follow the money, right? So I think it's helpful with this if you kind of follow how we've designed the money to be utilized in this bill. The first and most important part of it is the $191 million reserve capacity that we establish. That is a 1 year of operations of the TANF program, which exceeds just about everybody else in the country. And it will allow us the security to know that should something go awry during the course of a year, we have that reserve available to us to fund those things that are critically important to Tennessee and Tennesseans. It also provides that if during a really bad year, for example, the agency had to go into that reserve capacity and spend that money, then in the next year, they would have to replenish that $191 million before they could use the resources for anything that might be in this program that we're promoting. So it creates a structured methodology for maintaining a reserve capacity. The bill also creates a structured methodology for how we would suggest we utilize the remaining funds. So you've got about $735 million that's in this reserve capacity today. You're going to spend 191 of it right away and put it into this reserve account. So that brings you down to about 500. I'm going to round numbers here. about $545 million. So now you've got $545 million sitting in this reserve capacity. Our proposal is we take 300 million of those $545 million, and we use that, as Blair has discussed, we use that to develop programmatic ideas on the best types of ways we can efficiently and effectively help Tennesseans on a path to prosperity. That is, getting people out of government dependence. And we're asking our local communities and organizations in our local communities to help us design that path. So I'm going to, because everybody else knows I'm going to move kind of, can you see my little graph here? Can you see that, Blair? Okay.
Looks great.
So here's how we do it, and then I'll yield to Representative Hawk, because this is really this is really kind of the guts of the bill that really makes this unique and makes it work. We say we're going to take $300 million. Now, when you read the bill, it says we're going to give $5 million for what are known as planning grants. So we take this $300 million and we immediately take $5 million of that $300 million, and we say, okay, we're going to provide $500,000 each grant to people all across the state of Tennessee to either further develop what they're currently working on or create new ideas of how we might effectively utilize the TANF funding. For example, someone might come back and say, you know what, people who are receiving TANF funds, if they apply to a university or a TCAT, we might ought to enhance their cash assistance for them doing that. Okay. And they put that in their planning grant and they come up with that idea and they develop that idea and they practice that idea. And then they come back. And if they think they've got a good enough idea, they will submit it to the department and to the advisory commission and will compete for the remaining $295 million. Okay. There will be 8 grants or 8 projects at that point that will be funded at $10 million a year for 3 years or $30 million. So let's take the idea that says, hey, if a person on TANF assistance seeks continued education of some sort, and we want to enhance their cash assistance, and that program is selected by the advisory board and by the department to be studied over the next 3 years, then it gets funded at $30 million, $10 million every year. And here is the part about the bill that is really unique to this. Part of the requirement of the bill is that anybody that's in this 8 projects that are selected from all across the state have to subject themselves to a rigorous study of the success of their program. Those are usually done through randomized controlled trials. That's the most effective study that's done. That's the one I would personally suggest, but we'll leave that up to the experts. But because we want to know what works. And here's why. One, because of the fiscal conservative nature of Tennessee, we don't want to spend money on things that aren't working. It may feel very good, but if it's not working, we need to invest in things that work. Number 2, if we can prove something that works, then we can scale it up so that we can share it amongst more in the state of Tennessee. But even more importantly, other states can look at what we're doing here and go, hey, that's a really good idea. They've proven it through research that it works. We should adopt that here, because Tennessee is not the only state that has citizens that need help, okay, and families that need help and children that need help. And so we've been a leader in a lot of areas, particularly around education. This is another opportunity for Tennessee to be a leader. So that $300 million investment in program development is critical to helping DHS, helping local communities to determine what are the best methods for helping Tennesseans. And then over a long-term basis, once we've figured out what works, then it makes it easier really for DHS to then invest the dollars properly to keep those programs working long-term. I'll stop there, Blair, and yield to Representative Hawk, who can add probably a lot more flavor to it than I can.
Thank you, Senator Watson. Bo and Blair, thank you very much. And the whiteboards are always good. I want to expound a little bit on some of the dollars that have not been spent at this point in Senator Watson's discussion of the monies. There, at least in the first year, and hopefully going forward, there's going to be some money for locals as well, for community projects that may or may not have been funded by requesting funding through the TANF program from DHS in years gone by. But you may have some very solid programs that are helping 50 families in community XYZ that could be improved and scaled up and help even more folks. And I use it on such a small number of families that you're helping 50 families now, but how could we help 150 families with just a small amount of money that we're talking about? So we're going to have opportunities for every county across Tennessee to participate some way, shape, or form, to put the plans out and some dollars be attributed to them on a per child basis of those children in poverty. So there's some real opportunity there on a much smaller level to get dollars back into our communities to do the most good for those folks. And just to reiterate as well, the $191 million that we're talking about that comes in on a yearly basis, the cash assistance program is going to continue. We raised that amount of the family award on a monthly basis maybe 3 or 4 years ago. I sponsored the legislation, I guess about 4 years ago. The last couple of years is the Haslam administration. We upped that to the low 200s a month. And what that's for is just to get that family who needs the assistance, as Blair was talking about earlier, the family of 4 that's making $50,000 a year, that $200 a month is going to help them with gas or with the last little bit of whatever they need to keep them off of full-blown public assistance. That's what we've got that there for. So that's going to continue in that form, and we'll continue that. We feel comfortable that the $191 million reserve at this point is a good number. We're certainly looking to work with Department of Human Services as we have this conversation. That's really what I wanted to add, Bo, is just the fact that all counties are going to have an opportunity, maybe not quite at the degree the 8 pilot projects we're talking about, but every county and every community is going to have an opportunity to participate some way in this program.
Yeah, that's a great point, David. Actually, they have an opportunity to participate a couple of ways. One would be in the $500,000 planning grants. So you come up with ideas and then compete for the large 8 grants across the state. The second way is that of the $191 million, when all the, I'll call them necessary expenses are paid, whatever is left over. So let's say that out of $191 million, we spend $90 million on the programs that we normally operate out of DHS, and there's $90 million left over. That $90 million would then be distributed at the local level, at every county, based on the number of children, the percentage of the number of children living in households at or below poverty. So actually, local governments or local entities, local nonprofits, have an opportunity to participate on 2 different levels. Really 3, because some of them are already being funded by DHS. Some of them might be new and be funded by DHS. And some of them may just be an idea that needs to be funded. So really, we are trying to create a robust environment for creative thinking that is evidence-based or evidence-driven, that expands the universe of what we can do to help people who are in situations that need help. This bill does not address the cash assistance. That's already in the system and nothing about that changes. Now, again, as I talked about earlier, someone might come up with an idea of how they would enhance that and use these resources to do that. So we just think that the structure that we put together here, because it's structured and it describes a specific methodology, it's very explainable in our mind to the public of how we are effectively utilizing their tax dollars.
Oh, well, very well articulated. Wow. Thanks to both of you for that. I'm gonna turn it over to questions. We had a bunch of questions come in early, and I'm gonna call on a couple of folks in the order that we have received them. Some of the questions may have been answered. This has been very thorough so far from Senator Watson and Representative Hawk. But please do, even if you feel your question's been answered, I'm going to call on you anyway, and feel free to make a comment. And I'm going to start with Mayor Jake Bynum, Weakley County. Mayor.
How are you, Blair? Thanks for doing this and putting together. Especially thank you to Senator Watson and Senator Hawk on your work with the TANF funds. I've been fortunate to participate with TQEE through their Day on the Hill several times, and appreciate that. Not this work, but the work that you all have done with the Child Care Task Force and the School Nurse Bill, and I hope about those as well. Just briefly, Blair, before we finish today. But a question I have about this bill in particular. So obviously got to this point because it's kind of hard to understand where this money is and how it comes in and the monitoring of it. And so I just was interested to see if there in the bill, this addresses also improved transparency and monitoring both of our existing funds, how funds are spent in the future, and then not only on the program, but also just sort of in the overall balance of the funds.
So a couple of things to unpack there. Well, first of all, it requires the comptroller to report on the funding and how the funds are spent. So there's a report that's generated. Secondly, this is again unique to this legislation. It requires that the 191, once we've set aside $191 billion in a reserve, it requires that the $191 million that we get every year thereafter is 100% that has to be expended. So they have to spend it. And of course, the comptroller accounts for all that. But that's really unique because that's how we've developed this huge reserve, is that we haven't always been utilizing the resources that are available to us. And with this money sitting in a capacity reserve, it has absolutely no value to us. We can't invest it. We can't do anything with it. It's just money that's sitting there. So the bill challenges DHS, challenges the advisory board to make sure we're utilizing these resources as effectively as we can. And from a research perspective, because we are demanding a rigorous study, then the accountability of what we're doing with this money is even heightened. So I think from a transparency perspective, this bill kind of hits all the buttons that the public would expect when you are exploring ways that you can lift people out of poverty, or you can improve a person's possibilities in life.
Yeah, and Mayor, I agree. I think the two words there, it's forced accountability, and transparency is going to be a part of that. Whereas, and I'll use my legislative colleagues in the House, you could count on one hand how many folks in the House even realized that there was such a large capacity being built up. Now, all 99 members of the House, we're going to get a report on a regular basis. We're going to understand. And hopefully my legislative colleagues in the House, as well as Senator Watson's colleagues in the Senate, are going to hear from these programs in their cities and towns. And they're going to be able to participate and advocate for those programs and get a firsthand knowledge of what's happening inside of the communities. And Mayor, as you know, our constituents are not bashful at all. They're going to tell us if they feel something is working, is not working, and we're going to be able to be that report ourselves as a legislative body. So thank you very much for that question.
Thank you, Jake. Mayor, next we are going to hear from Mark Sturgis with Seeding Success in Memphis. Mark, you there?
I'm here. Thanks, Blair, Senator Watson, Representative Hawk. Just really appreciate the information today and walking us through implementation. I work with a nonprofit here in Shelby County that has spent a lot of time trying to figure out how to work better with the state hand in hand to reduce poverty, improve economic mobility, particularly in a part of the state that is has a very significant challenge there. And this legislation really sounds like it's thought through, it's structural, so we don't have to guess every year, how we will partner with the state on this work. So I'm just really appreciative of both of your leadership here, and any way that we can support in Shelby County, we're here to do that. And we actually had a great conversation with our county commission yesterday, walking them through the legislation. A lot of positive support there, and they're ready to stand up and support the bill as well. So thank you both.
Great, thank you.
Mark, appreciate that comment. All right, we've got a question from David Connor. David with the Tennessee County Services Association, right, David?
Yes, thank you. Thank you very much for putting this on, and Chairman Hawk and Chairman Watson, thank you for all your thought that's gone into this. I very much appreciate the approach that you're having, trying to focus on good evidence-based programs and good outcomes for these people. I wanted to ask something. There's in one section of the bill, you mentioned that there may be certain counties where they are unable to spend their allotment of funding due to a lack of qualified providers. Are there some incentives built into the bill for places where you identify good evidence-based programs to help encourage them to spread or to relocate in those areas that suffer from a lack of programming?
Well, I guess I would say yeah, go ahead, David.
No, I was going to jump onto that as well. I think, and David, as you know, I'm from a more rural area where we've got some smaller counties that may not have all the entities or organizations. And what I can envision with this legislation is, I'll use, say, a college or university has got a particular idea of something they'd like to see, and it could become regional by nature. And I'll use my area again, East Tennessee State University, in-home nursing program, something of that nature. They're located in Johnson City, Washington County, but they could go throughout the 8-county region and provide services. So they could become a provider for all the different communities in that area, absent someone in I'll use a Hancock County as a population of less than 8,000, one of the smaller counties. They could become a conduit or an arm to handle that situation for Hancock County. I can envision that with the legislation, David.
Yeah, I think the legislation tries to acknowledge that there are some communities that just don't have some of the capacity, and they might need some economies of scale in order to make the program work. But I think from an incentive perspective, the $500,000 grant to develop a program or to develop a regional program or a regional concept is an incentive for our agencies to work both really collaboratively with each other to maximize the effectiveness of what they're doing.
I'll just again.
That's a great question, particularly for the rural areas that do have some capacity issues.
I just appreciate how much thought's obviously been put into this.
Thank you, David. Thank you for your comments and your great question. It was a really good one. Next, we have Nancy Coffey representing the Memphis Chamber, the Greater Memphis Chamber of Commerce. Nancy, you there? Still muted, Nancy.
Sorry about that. Blair, thank you. Thank you so much for your work, and also a special thanks to Senator Watson and Representative Hawk for your leadership on this issue. As others have said, thanks obviously not only for this bill, but also for the Child Care Task Force and school nurse bills. The Chamber really looks forward to working with you and TQE and others across the state to support all of this. But here's my question. So thinking about the adverse impacts of the pandemic on our communities, could you please comment on what sort of circumstance would trigger the use of the $191 million in reserve that the bill sets aside, and how they'd be replenished. You spoke to that a bit in your comments, but if you could go into more detail, that'd be terrific.
Okay. Well, the bill doesn't direct the use of it. We leave that to DHS and local organizations and local communities to determine what is the best utilization of the resources. What the bill does require is that if you are going to plan a program, or if you are selected as one of the 8 larger programs, that it will be evidence-based or evidence-driven. And then if you're a larger program, you will subject yourself to, I'll call it, scientific study. But we don't presume to know what every community needs in the bill. We try to, I mean, the idea is to create ideas. That's the whole idea behind the bill. So we try to make it broad enough that communities are stimulated and encouraged to come up with new ways of dealing with the problems that exist in their area. To the $191 million question. So, and this gets kind of confusing, and often in talking about it, I confuse myself. So in the very beginning, out of the large capacity reserve of $750 or so million, we're going to take $191 million of that, and we're going to move it to the side, and that stays in the capacity bank. Okay, that stays there. Now this year, Tennessee will get another $191 million or so to spend in the DHS TANF program. Our bill says they have to spend all of that, okay? So you've got the 191 sitting over there, but we're not spending that. We're spending the annual allotment that comes in, which is 191. So for their normal kind of operations, they may spend, 80, 90, $100 million of that. Well, if they've got $91 million left over from their annual allotment, then the bill requires them to distribute that to all the counties based on the percentage of children who are living in households at or below the poverty level. And the reason that we do that is that there are some programs out there that aren't going to compete for the $500,000, that aren't going to compete for the big package, but are serving very vital purposes in their community. And we want to get those resources out to them as efficiently and as effectively as we can. And so at the end of the year, the annual allotment balance will be 0. That's the goal. Now, in a year where perhaps because of something catastrophic and the department has to spend more than $191 million, and they have to draw down from that $191 million reserve capacity that we've established, the bill says that the next year they have to replenish that $191 million capacity before they can start spending on other things. So a county might not get that extra money in a year when things have been really, really tough. We do that because we think we need to protect certain components of the TANF program with that $191 million reserve. And so that's how we establish the security that we think the system needs. I hope that clarifies that for you.
Thank you. Yeah, excellent. I appreciate it. Thanks.
And if I could, Nancy, just to elaborate, and Senator Watson did a great job answering that question, but just the historic spend and what we've seen over the last 4, 5, 6 years, the historic spend makes us or gives us a level of comfort as we look at this particular legislation, that we're absent something much more dire than the situation we're in right now. We're still going to have the capacity and the reserve fund available to us.
Excellent. Thanks.
Nancy, thank you. I think Lee, you think we have time for one more question? I'll put one more in here. We have Sean Lee, who leads Porter Lease. And Sean, you may have had your question answered, but I defer to you if you have a different one or a changed one, or just want to make any comments.
Thank you very much, Blair. I appreciate the time. My question, I was a little too quick on the trigger, but I'm with Porter Lease. We're a Memphis and Shelby County early childhood provider, from home visitation through early Head Start pre-K. And my question was really around the $300 million but Senator Watson was great in explaining what providers like us on the ground should expect for the use of those funds. So I'll leave time for others and just say a quick thank you to both of you for your leadership. I think you've really created a smart, fiscally responsible, but bill that's going to get money out there. A rainy day fund is good, but it's raining out here, and I think you're really going to help a lot of families through this legislation. So we appreciate you very much.
Thank you, Sean. Well, okay, I think that puts us here. We got about 12 minutes left in our hour. That said, if we need to go over a couple of minutes, we certainly can. We do want to cover briefly our Child Care Task Force bill and our school nurse bill. Actually, Representative Hawk is one of the sponsors of the school nurse bill that is part of our legislative agenda that we're supporting. I do want to be respectful and acknowledge that Senator Watson and Representative Hawk have not yet signed on to the task force bill in support of it, but we're just certain that they will. But I wouldn't want to suggest by having them featured up here when I talk about it that they're sponsors of that bill. That bill is actually Senator Massey and Representative Patsy Hazelwood are the co-sponsors of that bill. And I'm just going to briefly talk about that. Let me just, before I jump though, let me just see if there are any concluding remarks that Senator Watson and Representative Hall want to make.
No, just thank you for allowing us this forum. I would say to your audience, this is our approach and our idea. There are a lot of good ideas out there. We think this is a really good one, but we certainly also recognize there can be improvements. And so we would ask that you share those with Blair or with myself or with Representative Hawk, and let's put together something that really works well for Tennessee and for Tennesseans.
And echo those thanks as well. And I think Senator Watson said this earlier in the conversation, but we're looking to innovate new ideas, looking to expand upon programs that are working in areas. We don't have to reinvent the wheel. There's some programs that are working in certain areas now that we could replicate, given a little bit more funding. So we want to try to do that and enhance those programs. I'll stay on and talk in a few minutes about the nursing legislation too, but thank you, everyone.
Thank you, gentlemen. My hopes, I just got prompted to unmute myself. I was launching into my presentation. Child Care Task Force bill. Jonathan, if you would put up on the screen the slide on the task force bill. We talk a little bit briefly context here for child care in Tennessee. TQEE last year, 2019, did a study to kind of put some data to the anecdotal sort of evidence that we had around the need for child care across the state. And we surveyed 2,300 parents of children under the age of 5 across the state. And the slide up there is just a bunch of our sponsors. We had a number of business organizations, chambers of commerce, and the like support it, because we really took it from the lens of how does childcare impact both the workforce of today, but particularly in the workforce of tomorrow. And we really looked at it through the lens of sort of a workforce productivity and economic impact issue. Next slide, Jonathan. So what we found was, and this was across the state, and we actually did these regionally as well, but what we found was across the state, it was pretty much the same response. On the left side of this little chart you see there with the little people, you can see that 35, as a result of insufficient childcare or inadequate childcare, 35%, so fully a third, had their pay or hours reduced or changed to part-time because of insufficient childcare or childcare challenges. Another third had to quit a job, were fired or demoted. 39% had to turn down a new job offer or promotion. 33% turned down education or training opportunities. And on the right side there, you see, so what were the major challenges that were causing those issues? And 50% of people said parents said they had trouble finding quality care. 63, so 2/3 2/3, 63% said affordability was a major issue, and another 2/3, 65% said access. So meaning if there's enough slots, open slots available, if they're in the hours or that you work, if you work odd hours or off hours, if there are sick childcare, those kinds of things. So huge impact. And then next slide, Jonathan. We engaged an economist who helped us crunch some numbers around this just so we can understand the economic impact on Tennessee. And the total impact was $1.34 billion in terms of economic losses to our state due to insufficient childcare. Parents bore the brunt of that, so $850 million in lost earnings, businesses $270 million in lost revenues, and taxpayers a $220 million adverse impact. So a big impact, and this was 2019, so pre-COVID, and we certainly know we have not done research across the state during the pandemic, but we know nationally there's been a lot of research done and tremendous sort of adverse impacts on our childcare industry, on parents. So the childcare industry, the childcare system in Tennessee we have a lot of wonderful providers out there, and there's just a lot of parts and pieces to our system that aren't kind of working effectively. And so this bill would basically establish a task force that would be appointed by the General Assembly, and it would have some representatives from the administration, some of the key departments who are stakeholders in childcare. Those include education and human services, labor and workforce development, and economic development. Their task would be to create a strategic action plan to guide the administration and General Assembly to address the challenges of quality, affordability, and accessibility of childcare in the state. And they would look at more effective use of public resources to address those challenges, build partnerships between government and the business sector, and streamline coordination between the Department of Human Services. And I will say that there is a federal funding stream called the Child Care Development Fund that specifically goes to fund childcare. We have, as a state, and this is not the case for this most recent year, but in prior years, really the prior 5 years, we have been underspending that CCDF fund significantly by leaving about $200 million or a little over on the table. And that gets forfeited to other states. That doesn't get stockpiled like the TANF funds do. So very important that we make sure we're using all the resources available to us. And this task force would set forth a strategic plan that helps us really have some goals, some metrics, and better utilizes resources that are already available to us. So with that, I'm going to pause. And I'm going to let Lee, I'm going to give you a moment to just briefly talk about the school nurse bill, or if Representative Hawk would like to dive in.
I'll just lay a little groundwork, and let me say that you can see the school nurse bill, the link to the school nurse bill in your chat box. If it's not there, it'll be there just any second now. The Child Care Task Force bill is being drafted currently. So just as soon as we have that link available, we will send that to you all with a follow-up email, most likely early next week, letting you know the status, and just so that you can monitor all three of these pieces of legislation. I'm gonna turn it over to David Hawk, who's graciously our House sponsor on the school nurse bill also, but just a little background. We're fortunate in Tennessee that through the funding formula of the basic education program, that Tennessee recognizes the importance of school nurses, and have so since 1992, which was with the creation of the basic education program. The challenge we face now, almost 30 years later, is that school nurses in 1993 were funded at the same level they are in 2021. So that's the trouble. I think we all recognize the importance and the connection between healthy students on the emotional, mental, and physical level, and the correlation to success in academics and at school, and the importance of this area. And happy to hand it off to David now. And thanks again, David, for your work on this issue also.
Thank you, Lee. And that ratio is 1 nurse to every 3,000 students in the BEP formula right now. The legislation that we're going to be introducing, actually introduced it today in the House, and we'll have it in the Senate very soon, is going to reduce the ratio, the funding ratio of nurses to have one nurse for every 750 students in our school systems. Many situations that gets us to one nurse per school building, which is an ideal situation. Our students, when you look at where our student population was 30 years ago, there are many more students with a IEP and individual education plan now than there were 30 years ago. And many of those IEPs revolve around healthcare and potential medications, shots, injections, feeding tubes even. So there's so many more aspects of need that our students have now that they didn't have 30 years ago. What this is going to do is going to help the existing school systems, and there's several school systems across the state of Tennessee. I've got one in particular. There's a school system I'm aware of that has 6 school buildings, but their student population is right at 3,000 students. So they are funded one nurse for all 6 buildings. Well, what they do, they've been able to step up to the plate locally and fund those other 5 nursing positions inside the school buildings to have one per building. Well, that's taking dollars away from what could be going into the classroom. So we're going to try to create a better ratio of that funding to where local governments are able to put more dollars, put their money where their mouth is, so to speak, and put more dollars into the classroom studies that we've discussed. Back to the earlier part of our conversation, where there are many rural counties across Tennessee that are only able to have that one nurse for every 3,000 students. And they really have some medical necessity, some needs within their school system, that this bill would help them on the ground floor, getting more medical professionals into their school buildings on a daily basis. So it's really coming from a 2-pronged aspect. And this is something that the BEP review formula has favored for quite some time now, and hopefully we can bring it to fruition very soon. So thank you all.
Thank you, David. And Blair, I'll turn it back over to you. See if there are any questions about either one of those 2 proposals.
I think we're here at the end of our hour. I do see there are a number of questions in the Q&A here, and we'll work on making sure, if they haven't been answered, we'll work on making sure we get responses back to those of you who've put them in here. I think Lee, I think we'll just try to, since it's 1:59 here, I think maybe we'll just try to wrap up on time.
Okay, great. Just as we close here, you see my contact information. If you have questions that weren't answered, I've tried to jot some of them down, but feel free to reach out to me at my email address there. Look for an email, again, probably early next week, just as a follow-up from these conversations, to give you the bill numbers, to give you the anticipated legislative path to success, and then to also give you some opportunities for your organizations to engage if you are so inclined. Again, thank you very, very much to Representative Hawk and to Senator Watson for the time today. Thank you for everyone in attendance. I hope this was informative and beneficial and leads to us all working together this session for the kids and for the families of Tennessee. With that, we are adjourned.